Alright, so what's happening today?
We're getting Max's second frenectomy.
Why are we getting him a second frenectomy?
Because the first one didn't work.
Is that because we didn't do the exercises?
Yes.
So we're torturing our son for the second time.
Yep.
Okay, so Max, are you gonna forgive us? Okay. We gotta go get ready. Alright, so we're here. So we've done this before, so we know what to expect, right?
Yep.
You hold him really still. He cries for like half a minute, and then he's fine, and then we feel massively guilty, and he doesn't remember a thing. Are you all excited for surgery, buddy?
He's an Ed clone. He's a total Ed clone. He'll just take when he's a little older.
It's
take
the
him in your
laser.
car. Take him for a little.
Massaging with your clean fingers.
But that's what I did. I went like this all the time.
Like, grab it and pull it.
Okay.
Don't
Okay.
let it reattach.
Grab it. Here. Grab it. Pull it.
Yeah.
Down. Side. Side. Up. And then with your finger,
Yeah.
stretch it out and then just press on it and like that.
Ow, that hurts.
Okay?
Times a week.
How many times do we do that?
Before every feeding, let's say six times a day for a week.
For just a week.
Yeah.
We have teeth now.
Wow.
And the side ones, the ones that there are two more coming in.
We did a tongue too, right?
Yeah.
Okay, let go. There was some fibrous tissue down there too. Breastfeeding is good
Painful.
for you?
Yeah.
Is okay.
And he farts like crazy. Like crazy. Do you think that's because of the air? Like and he cries like he's like,
Right.
and then he farts, and then he goes,
Okay, we're doing both.
So after the procedure, he cried for a little bit. I fed him on the boob, and then we came home and he took a nap. Okay, so it's 1 o'clock. This morning at 9 a.m., his Uncle John performed a double frenectomy on his nephew Max using a laser. So as soon as the procedure was done, I gave him some boob. He fell asleep and we drove him home. He's been sleeping and now he just woke up. I haven't given him any pain medication. I do have a homeopathic version that I can give him later on tonight if he is in a lot of pain, but as of right now he seems pretty happy as long as I keep him occupied. So this is what it looks like a couple hours after your child has a double frenectomy done by laser. As mentioned before, he's had this done at 3 days old and now he's 7 months old. The reason we had to do it again was because I failed to do the exercises properly and both frenums grew back. Which meant that breastfeeding was a lot more painful. He was taking in a lot of air, and there's a lot of tongue tie issues when children grow up. So to avoid that, we had to give him another frenectomy. The difference between getting a frenectomy when he was 3 days old and the one at 7 months old was when he was 3 days old, the procedure literally took minutes, a minute or two, and he only cried during the procedure, and as soon as it was over, he was fine. At 7 months, the procedure took a little longer, only a few minutes, but it did take a little longer, and he cried during the entire procedure as well. But after the procedure, he did cry, and I soothed him and I fed him. So if you have a choice and you need to get a frenectomy, I would definitely say get one when they are young. It goes a lot smoother, but he seems pretty happy. So it's 2 months after his surgery, and this is little Max. I'm going to zoom in right now to show you the area that was worked on. So it's hard to get into his mouth to really see the area, but you kind of got a quick view there. So advice I have to any parents based on my own experience who are thinking of having this procedure for their children. Number one, this procedure alone doesn't solve all your problems. I feel it's a two-pronged approach to deal with this issue, which is number one, you have to know how to breastfeed properly, and number two, you have to make sure there is no tongue-tie issues. So learning how to breastfeed properly, whether that's through a lactation consultant or watching videos or whatever, and so you basically can't go to the surgery and think that right after the surgery you'll know how to breastfeed. This just helps you be able to breastfeed properly. So yeah, so having both of those together is important. Another thing is when you're looking at a professional to do the procedure itself, I would definitely ask questions. What types of tools are they using? Do they use a laser? Do they use, I don't know, cutting or whatever? I'm not sure what all of them are, but I would definitely make sure that you ask and you're okay with that. Then I would just see, does this person even know anything about children? Do they know anything about breastfeeding? Are they even good with children? How are they going to actually perform the procedure? Are you going to be allowed to be there? You know, all these kind of things. Is there going to be any medication administered? Why yes or why not? So make sure you ask all those questions. Make sure you're okay with it. And if you're kind of don't feel okay with it, then I would definitely try and find someone who does it the way you feel most comfortable. It was easy for me because the way my brother-in-law performs this procedure is absolutely the way I would want someone to do it. And he's an absolute perfectionist, so I know the method he uses is the best out there, because he's kind of like that. But anyways, so I hope this video helps, and I'm very happy. Max is very happy, and he's growing like crazy.